Hello students, today we will see about the anatomical planes and the anatomical terminology. These planes and the anatomical terms are very important to learn a basic subject, that is anatomy, and without understanding anatomy you will not be able to understand any medical fraternity or any medical courses. This is going to be useful in the lifelong, in the any medical fraternity. So let's see what is anatomical position and why it is important. You have to learn the anatomical position because it shows how the organs or how the structure of the body lies in the human body. So every structure in the human body you have to learn in an anatomical position. So let's see what is the anatomical position. In anatomical position, the person should stand erect, or I can say the straight. The head should be facing forward and eyes should be looking straight. Arms of the person should be hang at the side of the trunk or the body, I can say even the laterally. The palm should faces forward. The lower limb should be parallel to each other and the toes should be pointing forward. So this is about the normal anatomical position. If you know this in a correct way, you will easy to learn the structures, how lies it in our body. So let's see the planes. If you know the basic 4 planes, it will be easy to learn another planes when you will study in the detail or any speciality. So let's see, the first is a mid-sagittal plane. You can call it as a median plane. Yes, I am repeating, mid-sagittal or median plane. You can see in this picture, a median plane is a vertical plane which divides the body into two halves, that is the right and the left. So you can see this picture, this is the division which I can say the mid-sagittal plane or median plane. If you cut in this section, so this is the right side and this is the left side of the body. So basically even I can say in a single sentence, a medial plane lies vertically and it divides the body into two equal halves. Then what is the sagittal plane? Sagittal plane is again vertical plane which is a parallel to the body and which divides the body into unequal two halves, right and left. So the difference between the mid-sagittal and the sagittal is a mid-sagittal means mid of the body. I can say the median plane, mid of the body, and divides into two parts, two equal parts. Sagittal plane divides into unequal parts of the body. Then another one is a coronal plane, or you can call it as a frontal plane too. Yes, why coronal or the frontal plane? You can see in this picture, this is again the vertical plane at the right angle to the median plane. This will be the median plane and this is the coronal plane which divides the body into again two parts, that is front part is called as the anterior and behind the coronal plane this is called as a posterior. So this is about the coronal plane which divides the body into front and back, that is called as a, in anatomical terminology, anterior, and behind is a posterior. Now come to the transverse plane. You can call it as a horizontal plane too. Again, see in this picture, this is very easy because transverse plane, horizontal plane, it is horizontally lies. Obviously, horizontal plane or transverse, you know the meaning of this terminology. So this is not a new thing. That's why you can easily understand this. This divides body into two halves. That is again I can say the upper part and the lower part. This plane also at the right angle to the sagittal plane or the coronal plane. When the body divides, this is the mid-sagittal plane. This will be the anterior posterior coronal, and this is the right angle to the sagittal or the coronal, and divides body into the upper and the lower part. So this is very easy to remember. Now come to the oblique plane. This also name is giving you idea. The oblique plane means it should be oblique. So this is the any plane which is a perpendicular to the another plane. You can see in this picture, this is the again the parasagittal or the sagittal plane, which lies again, this is the oblique plane. If this plane will be again crossing to the transverse, this also can be oblique plane, this also can be oblique plane. So oblique plane means the plane perpendicular to the any plane, that is a mid-sagittal, sagittal, coronal or the horizontal. So this is about the oblique plane. Yes, this is again the revision, or you can have the quick idea about this. This is the human body. First, what we have learned, that is a mid-sagittal plane, which you can call it as a median plane too. See, this is the green, which divides the body into two equal halves, that is the right side and the left side. Then we have learned the coronal plane, or which is also called as a frontal plane, which divides the body into the anterior and the posterior part. Now we have studied the sagittal plane or the parasagittal plane. As I have told you before, it is yes parallel to the median plane or the mid-sagittal plane, but it divides the body into unequal parts. Unequal right and the left. Yes, transverse plane or the horizontal plane, which divides the human body into the upper part and the lower part. So this is about the planes of the body. Now again the second important thing, terms of position. In the terms of position, as we have seen the planes, these planes are going to help you how the organs, the structures or the where it is situated, that is the position of a structure or the organ in the anatomical position or in a human body. So as we have learned the coronal plane, you can see here is a human body, and this is the coronal plane, which divides the human body into front part, which is called as the anterior part. This is also called as a ventral part. So anterior and the ventral part of the position is the meaning is the same. I can say the front of the body or the organ situated anteriorly. Then the behind the coronal plane or the frontal plane, that is called as a posterior. This is also called as a dorsal, behind the coronal plane, or I can say back of the human body, or behind or the back side is called as a posterior or dorsal, and in between or intermediate, that is called as intermediate or the middle. So yes, coronal plane or the frontal plane divides into the front part and the back part. The front part is called as the anterior as well as the ventral. Back side or the behind is called as the posterior as well as the dorsal too. Then let's see how it divides, or in the diagram we will say it. The mid sagittal or the median plate, the structure or the position of the organs will be the medial or the lateral. This will be the two opposite words, medial versus lateral. So let's see what is it. The medial, you can see this is the midline or the mid sagittal plane or the medial plane. Towards the midline or near to the midline, you can see this arrow is called as a medial. If structure lies near to the midline of the human body, it is called as a medial. If the structure lies away from the midline, is called as it is lateral in position. So these two are the opposite, medial and the lateral. In between this, if structure lies in between this is called as a intermediate structure. Yes, again, horizontal or the transverse plane. As you know, it divides body into the upper and the lower part. Yes, upper part you can call it as a superior. Above the horizontal or the transverse plane, this is the superior. Below the horizontal plane, this is the inferior. In another terminology, a superior, you can call it as a cephalic too, and also cranial, because this is related to cranium or the cephalic. That is again I can say the brain. That is again the superior, that is called as a that cephalic or the cranial too. Inferior, this also you can say in other words caudal. So this is about the horizontal plane, which divides the body into the superior and the inferior part. Then there are the another terms which we can correlate with the limbs, upper limb or the lower limb. The commonly terms used as a proximal and the distal. The proximal will be the near to the trunk, and the distal will be the away from the trunk. You can see the hand or the wrist is a lies in the distal part of the limb, and I can say the shoulder joint or the biceps lies in the proximal, or I can say the proximally towards the joint or the towards the trunk. That again I can say the proximal is the nearest point to the attachment and distal is away from the attachment or the origin. This terminology basically will be repeated in case of the limbs and in case of the embryo also. Now yes, the other terms are there in case of the solid organs. Some will be the covered or a structure present on the superior surface of any organ or our body, as I can say the skin. So that will be called as a superficial, which is present superiorly, not a superior means on the surface, that is a superficially, and deep to that, this is the structure lies deep. Superficially, that I can say on the surface. So In this picture, you can correlate. This is the trunk, which is the cut or in the section. So this will be the superficial part, and deep to that, this will be the deeper structures or the deeper parts. Yes, interior and the exterior. This terminology is not new to you. Interior means inside. Inside view is called as an interior. Exterior means outside. How it lies or it's situated or how it's seen from the exterior or from the outside is called as an exterior. Interior is a inside. Yes, this we can again I can say a reference. Upper part is called as a superior. Lower part of the body is called as a inferior. Again, a superior part you can call as a cranial or the cephalic, and the lower part you can call it as a caudal. Coronal plane divides body into the front and the back. Front is also called as a anterior or ventral. Backside or behind is called as a posterior and the dorsal. Related to the limbs, proximal and the distal. Proximal will be the towards or near to the trunk or the attachment. Distal is away from the attachment or the away from the trunk. So for this, a midline or the mid-sagittal plane is very important. Medial will be the near to the midline. Lateral will be the away from the midline. So what is next is a unilateral, bilateral, ipsilateral and the contralateral. Unilateral means only one side. Only one side is affected. You can see in this picture. Bilateral, bi means two. Uni means one. Bilateral, that means two sides are affected. What do you mean by ipsilateral? I can say the same side of the body. You can see this is the upper limb and this is the lower limb. The two same side of the body, right side is affected. That's why it is called as ipsilateral. Now what do you mean by contralateral? Contralateral is a opposite side of the body. You can see this is the right lower limb, this is the left upper limb. So these are the opposite side is affected. That's why it is called as a contralateral. That means contrast. Ipsi means a similar side. You can see again you can correlate what we have seen in the before slide. Same side, ipsilateral, contralateral, opposite side, right? So this is again, just let's see the revise what we have learned in the planes or the directional terms. Very simple to remember. Medial, opposite to that will be the lateral. Superior versus inferior. Anterior, opposite to that is a posterior. Proximal versus distal. Superficial, opposite that will be the deep. Unilateral and the bilateral. Ipsilateral and the contralateral.